Disability rights activists brought their campaign for community-based long-term care to Chicago. Nearly 60 members of ADAPT were arrested in a protest at the American Medical Association headquarters yesterday. The protest followed lack of response to a letter written to the CEO of the AMA, Dr. Michael Maves, in July. The group ADAPT has pressed the American Medical Association to endorse home and community-based long-term care services and support for older Americans and those with disabilities, instead of nursing homes and other institutions. Organizer Marcia Katz says ADAPT sent a list of 4 demands to Dr. Maves. One of them was that the AMA support the Community Care Act, a bill currently before Congress that would give people eligible for nursing home or institutional placement the ability to instead choose community services.
Every state that participates in Medicaid has to provide certain kinds of services, including nursing home services. It does not currently have to provide the same services in somebody's own home in the community. As a result, people get forced into nursing homes and other institutions to get the long-term care services they need. The Community Choice Act would allow people to choose to remain in their own home and in their own community and receive any supports and services they want there.
Disability rights advocates say that states are required to provide nursing home services while community-based services are optional. Nearly 70% of Medicaid long-term care dollars pay for institutional services. The remaining money must cover all the community-based waivers and programs. Marilyn Golden is with the Disability Rights Education and Defense Fund.
But there are policy options to these problems, and the Community Choices Act is a perfect example. And the disability community, which has been really taking the lead on this issue, wants to raise everybody's consciousness that we all have a stake in changing the way long-term care dollars are spent in this society. The Community Choices Act is an excellent example of a policy that, if implemented, would, at a very fundamental level, restructure something that ends up impacting all of us.
A newer demand by ADAPT in its letter to Dr. Maves was the development of an ethics policy for physicians. Doctors would be required to divulge any financial interest they have in a nursing home when recommending long-term care to patients. Doctors would be prohibited from referring patients to a nursing home in which they have a financial interest. Marcia Katz said ADAPT is also demanding that the AMA Board of Trustees and leadership divest themselves of all such interests.
Right now, there are an amazing number of doctors who have ownership interest in nursing homes across the country. Those same doctors refer people to their nursing homes, the nursing homes that they own, as well as other nursing homes. The patients or the individuals with whom they're working have no idea that there is a conflict of interest, whether that is real or perceived, and end up believing that a nursing home is the only alternative for them, and it isn't.
Marcia Katz of ADAPT calls to the American Medical Association were not returned.